This is a training module on laboratory electronic health assessments, or lab EHAs. We will cover what a lab EHA is, how does it work, and why providers need lab EHAs. Laboratory electronic health assessments are patient-produced screenings performed on a tablet. These screenings are usually done in the waiting room or the exam room before the patient is seen by the doctor. Lab EHAs usually take about 6 minutes to complete, and once finished, a report is automatically sent to the provider via email. This report helps providers understand if a patient needs laboratory testing, the medical necessity of lab testing, the mental condition of the patient, and the different counseling codes that patient should receive. Doctors using lab electronic health assessments not only give the best patient care possible, they order more laboratory tests and can dramatically increase the revenue of their practice.
But only if they're using the laboratories that your firm represents.
Lab EHAs are simple to use and work this way. Office staff enters a username and password and hands the tablet to every patient that has private insurance or Medicare at least once per year. Patients fill out a battery of assessments, and this usually takes about 6 minutes to complete. And once done, a report is sent to the provider's email. Each EHA report is 5 pages long and is scored, color-coded, and easy to read. Every EHA report provides 3 major areas of interest for the provider: the scoring section, the CPT code section, and the medical necessity section. The scoring section is the top part of the report and shows at a glance what advanced testing that patient qualifies for, and the mental condition of the patient. This section of the EHA report is color-coded and easy to read, and highlights the areas of concern providers should address with their patients, as well as the need for advanced testing. The scoring section shows the provider if the patient is a candidate for advanced testing, PGX, CGX, carrier, and tox. The scoring section also highlights the mental condition of the patient and screens for depression, anxiety, opioid risk, and alcohol misuse. Treating the patient becomes simple. The scoring section gives an action plan for that patient's care. Doctors know what tests to order and have gained valuable insight into the patient's well-being and now have a plan for treatment. In the middle of the report is the CPT code section. The CPT code section will show the provider what services that patient should receive and how much money he'll make off of each of those services. Each of the codes that are checked off are determined from the patient's responses. Each checked response has a CPT code associated with it, the Medicare national average for payment for each code, and the number of times each code can be billed in a year. For example, cardiovascular counseling will pay the provider over $26 and can be done once per year. The lab EHA will produce revenue for your doctor in the range of $64 to $145 per patient per year. Remember, these amounts listed are Medicare rates, and commercial payers usually pay about 30% more. All of this information is found on the first page of the lab EHA report. The next 4 pages show how the patient responded to every question asked. These pages are medical necessity section of the report and is important to the doctor and the laboratory. Because the patient's responses provide the medical necessity for ordering lab scripts, providing counseling, and billing for assessments. Because of the information collected by the lab EHA, doctors and labs now have clearly validated reasons for providing the services that they order. Before we go on to why providers need lab EHAs, let's recap what a lab EHA is and how it works. Lab EHAs are done on a tablet, and the report is emailed within seconds of completion to the provider. The report is broken down into 3 sections: the scoring section, the CPT code section, and the medical necessity section. The scoring section shows the laboratory testing that patient qualifies for: PGX, CGX, carrier, and tox. The scoring section also reveals the mental condition of the patient and screens for depression, anxiety, opioid risk, and alcohol misuse. The CPT code section informs the provider of all the billable services that can be performed on the patient and the dollar amount he should receive for each of these services. The last 4 pages cover the reason that each test was ordered and shows the medical necessity for ordering each of those tests. There are multiple reasons why providers need lab EHAs. We're going to cover 3. federal mandates, better patient care, and increased revenue for the practice. In 2017, the government passed a new law called MACRA. MACRA has added new requirements for all providers, no matter the specialty of the doctor. MACRA now requires providers to perform as many preventative services as possible on all of their Medicare patients. Providers that do not pass MACRA will see a reduction of up to 9% of all Medicare reimbursements. Our Lab EHA helps providers with 6 MACRA requirements and is an easy way to help providers pass MACRA and keep from losing this revenue. Although doctors may think of themselves as superheroes, it's impossible for doctors to treat illnesses that they're not made aware of. Adding to this problem is most providers spend less than 7 minutes actually talking to the patient. With such little time spent with the patients, providers only have time to address the problem the patient came in for, even if that patient would benefit from advanced lab testing or have an undiagnosed mental health issue. Because the Lab EHA is given out to every patient at least once per year, all patients get screened for mental health issues and if laboratory testing would benefit them, no matter the reason they came in to see the provider in the first place. The revenue that providers can realize by using Lab EHAs is staggering. Most doctors have around 2,500 patients in their care. Each Lab EHA is reimbursable by the majority of commercial payers and Medicare, and the lowest reimbursement amount is right around $64 per assessment. That would mean that when a doctor uses a Lab EHA in all of his patients once per year, he would earn up to $160,000 without large expense or capital outlay. And when you add to the fact that commercial insurance pays right around 30% more, many times the doctors will make more money on the Lab EHA and the counseling than they will on an actual office visit.
Please remember, the Lab EHA is part of the services that your firm provides. And remember, the only way doctors can use the Lab EHA is if they're using your firm for their needs. If the doctor stops using your firm for any reason, the Lab EHA goes away, and the revenue that comes with it.
There are 2 different lab electronic health assessments, standard and pain management. The standard Lab EHA is designed for primary care providers and is the most commonly sold assessment. General practice, family practice, internal medicine, OBGYN, and others make up what is considered primary care. Urgent care centers may or may not work for the standard EHA. It depends on their contracts. If you have a question on this, please contact your trainer for more details. The Pain Management Lab EHA is designed for pain management clients. This EHA works the same as the standard EHA. The only difference is the billing amount. The Pain EHA bills out at a few dollars less than the standard EHA, right around $50 Medicare. But it can be given to all patients 4 times per year as opposed to just annually. Please note that chiropractors, dentists, podiatrists, veterinarians cannot bill for either the standard or the Pain EHA and are not candidates for this program.
The Lab EHA is owned by your firm, and only your firm has it.
ThoughtSwift's job is the company that helps service all the clients that you sign up. Our job 1 is to help your doctors be successful using the EHA. Our job 2 is to help you, the salesperson, put more Lab EHAs in more offices. If you have questions, please call us and we'll help you in any way we can. If your doctor needs more data, we'll send it. And if you need us to make a sales presentation about the Lab EHA and how it works, we will be glad to do it for you. Just go to calendly.com/ThoughtSwift to set an appointment, and we will send you and the doctor a webinar link to explain how our Lab EHA program will work in their office. As we mentioned before, the Lab EHA is part of the services that your lab provides. But to ensure there are no inducement issues, the provider is required to sign a service agreement with ThoughtSwift. The cost for the Lab EHA is the lowest we could possibly make it. A one-time setup fee of $299 and $99 a month thereafter. If there's a way that we didn't have to charge for this, we would. But to stay compliant, the doctor has to pay something for this outstanding service. This service agreement includes all the things a provider will need to get started using the Lab EHA. 2 program tablets, implementation training to make sure everyone knows how the program is going to work, a HIPAA-secure email for all the results to go to, billing support to help ensure that doctors make money, and a dedicated customer service rep to help if there's any questions. ThoughtSwift partners with you to ensure that you are successful and that your providers have everything they need to use the Lab EHA. Congratulations! You have finished the first part of training. Let's sum up everything we learned. Lab EHAs are done on a tablet, usually in the waiting room of the examiner. When complete, the report is emailed instantly to the doctor. The 5-page report shows all the information the providers need to know, including what tests to order, medical necessity for the testing, and what to bill. Doctors need Lab EHAs to help with their macro requirements, also take care of their patients, and for the revenue that's generated for their practice. Please remember, we offer 2 different Lab EHAs depending on the specialty of the doctor, and that ThoughtSwift will help you in any way we can, including help sell your accounts and service them once they're sold. Thank you for watching the first training video for electronic laboratory health assessments. Here is my contact information, and if you have any questions or comments or concerns, please feel free to contact me. I look forward to speaking to you soon.